Welcome everyone again to part 2 of the InterX training. This week we're going to learn a little bit more about how to use the device, how to select your settings, and some of the treatment techniques that we do with the InterX. So I'll hand it over to Zulia and you can take it from here. Thanks, Zulia.
Thank you, everyone. I'm glad we're seeing each other again. Today is more about practical applications and how to get the best results from the InterX. I'm going to show you some protocols which I recommend you to follow and explain when you're going to use it. Consider that those techniques are your tools. So let's look at the shared presentation. Okay. So what you're going to see here today, we're going to look through the basic technique, Dermatome, soft tissue release, 3-and-1 protocol, and Spinal Assessment. In the end, I'll share with you with some case studies I've done because you need to understand what kind of results you're going to expect. So basic InterX treatment techniques for acute and chronic pain. First of all, let's examine, for those who just a novel user of the InterX device, very brief tour into understanding the device. So you could have you turn it on and plus and minus buttons, to alternate your intensity in the program and also your cursor, so that the screen will basically design for you to understand what are two types of problems you're going to have with your patients. Is it acute or chronic? Okay, very simple decision tree. And the third button is specifically to functioning of the flex beam, which is accessory, which allows you to treat automatically or in automated way through cycles. And you've got all the presets and programs in this little icon of the book. So this is what your decision tree on how to choose which presets. First of all, please understand that if you choose acute presets and any within this box acute presets, you will be absolutely fine. It doesn't have to be a very specific frequency, but I will explain to you the rationale behind it. So there are different sets of frequencies under each set of actions. So acute, it's always, we agreed, anything up to 1 month will be considered to be acute. So if you have, for example, here you have 180 pulse per second, and you can see a magnifying glass next to it. What it means you can measure skin impedance when you use device in this program. But the second program, which you could see, there is an oscillation, and this is oscillation between 30 and 120. So with this oscillation, it's going to go through different frequency patterns. So it's set up slowly at 30, and then it goes very fast up to 120, and then again slows down to 30. So because the frequency varies, it's very difficult for you to get a precise number of the impedance. So you're not going to be seeing anything on the screen. Then you have 90 to 360, another range, yes? When we're going to use this range, we're going to use this range when we actually move the device on that step of the scan target dynamic. So when you want to measure, scan, or you want to target, you need to choose only the one which is with the magnifying glass. So 180, 360, 400. There's two 480s under this preset. So my recommendation to make life easier, just always choose 480 when you have acute situation, particularly when things happen very, very close to onset of injury right now. If you put on 480, it's almost like your emergency protocol, you're doing it. And then when you target it and then you start to move the device, then please change either to 30-120 or 90-360. So this is acute protocols. The reason why you have the 360 and 180, it's because if patients, you start treating from day number 1 and they still recovering by week 4, then you need to alter, because you don't want to create the same protocol to reduce accommodation to your treatment. But mainly you're going to be just using 480 and one of these two variables, most of the time 90-360. Then there is a second screen, it's for chronic condition. Please understand here, this is anyone after 1 month, okay? So if you get person who experienced that injury or pain condition over 1 month, you're going to be working only within this box. And it doesn't matter if they have pain 10 out of 10. The matter is how chronic the process, okay? In fact, if they have severe pain and they are very, very chronic, like conditions for years, you go for lowest number, like 15, yes? So anything here, chronic, whether it's chronic skeletal muscular or chronic neuropathic, it doesn't matter. It always has to be in this box. Okay, so the presets you have 60, 15, and then you have two variables, 15-60, the lowest, 30-120. It's the same as here. So this is universal. If you're completely stuck and you forgot what I need to do, use this. When you move the device, use 30-120 and 240. Well, if it's skeletal muscular pain and it's very strong, use 240, okay? But if it's a neuropathic pain, you go for 15. We have the protocol for you there. And last box, as I said, it's for your flexible array. And here you just choose best just to use in cycles. This is my recommendation. So you have cycle 3, cycle 2, and cycle 1, yes? So cycle 3, it's more for chronic conditions. Cycle 2, it's between acute and chronic or aggravation of the chronic. And cycle 1 for acute conditions. So here it's a very simple rationale. So this is a rule for you to visually understand the presets on the device. So you could see on one end, where is an acute just happened condition, you need to use high frequency pulse. And all of these variables will be high frequency cycle packed with high frequency pulse. And as you go into chronic state, then you become more sort of mid-range on the chronic. So you have 240, 30-120, cycle 2. And to very, very, very chronic patients, you're gonna use 15 pulse per second, 15-60, and cycle 3. This is really, it's a tapping very slow. It's a least energy containing preset. So this is very gentle introduction energy to the system. And here you have very strong pact of energy situation because your body can handle it. You've got some energy reserves, but very chronic patients, they expend all energy. And if you start blasting it, you're going to create so much aggravation for this. So what happened if you mix these two boxes and you didn't do it right? Well, you might not get result. So with if you use low, not enough energy presets with acute, you may not get pain relief. And if you use very high packed energy settings with chronic, you can create unnecessary aggravation. So this is just to help you to understand it this way. So right now I need to tie these presets to understanding of the chronicity of the patient. So I explained to you that there is a sort of from timing point of view, yes, the minute patient has got some trauma, when let's say there was an injury or there was with complex regional pain syndrome, there was a compression on the nerve ending like by a very tight cast, for example, something related to an injury. So you have a very, very short in the minutes, like say like 30 up to 30, 40 minutes window. It's a blue color. That means this is before the body start kicking inflammatory response, okay? If you manage to get this patient at this stage, and it just happened, like this is would be applicable for your injury, like walking at the door or shutting door at your fingers, you know, it just happened. You need to use this blue, which corresponds to 480 pulse per second. And this is will help you to actually reverse. So the body will not go into inflammatory step. And this is quite dramatic. I have seen this a few times in life, and it's just unbelievable, particularly where I've seen, I use it on any type of virus infection, yes? If I feel the very first symptoms coming, like scratchy throat, I'll put over the throat in InterX, and I reverse it completely. I don't go into being ill. This is quite phenomenal, but you can get these results if you burn yourself. Like, for example, yes, I burned myself to 2nd degree a few times. And when you use InterX immediately on the burn side, you immediately arrest pain, and the body does not go through inflammation. There was no swelling, nothing. You just experience like very quick resolution. It may not look terrible, but there is no inflammatory response. So this is very important for your patient to get to use InterX at this small window. However, if you miss this small window of opportunity, I call it, the body starts inflammatory response, and the pain, you can see this diagram for pain, shoots up. So with acute phase, inflammation and pain is very strong. So we still use 480, or if we use variables, we use 90 to 360. After the inflammatory stage, most of the time, we get our patients at this stage. This is acute or already started chronic process, yes? So in this process, pain kind of oscillate like this, yes? And when you start treating with InterX, you use 240 if it's skeletal muscular pain, and you'll be using 15 if it's a neuropathic pain. So oscillation is 30, 120, here is 15 to 60. But normally you would go at this stage because it's just relatively close to the onset. And when you start using InterX in patients who are very, very chronic, look at this, what's going to happen. You see this exacerbation of the problem? Green. So your pain can start going up and down, stronger in your patients. So you have to tell them that this process is very, very likely going to happen. Typically happen once throughout treatment course, aggravation of the chronic pain, and it's necessary because I must tell you one thing, you never heard it before. The body always heals through inflammation, yes? And if you bypass inflammation and you're not resolving it, and the people stuck in the inflammatory phase, this aggravation, it's necessary to activate natural body resources and step into inflammatory response. Don't be afraid of this. It's going to last only for a few hours because it's almost like a phantom. So the body has to remember, oh yeah, I started the inflammation. Because when you suppress that pain with the massive drugs and everything, so what's going to happen? The body cannot re-inflame and then resolve the issue. So I'd say InterX uniquely treats through bringing body into inflammatory response. So, but once you overcome that few hours of the aggravation of the symptom, what is happening after that? The body responds to healing very, very well. you just quickly go into this resolution state, remodeling state. So this is repair state where we get most of our patients. However, sometimes patients come to you and their condition is due to scar formation. Yes. So for example, they had a spinal surgery and the scar that is formed is not remodeling, it's not resolving, because often people don't have enough energy reserves for that. So in order to get into, then you deal with patients who are like this. At least locally, you tap the scar with a 15 pulse per second or 15 to 60 oscillation. Then you're going to get results, okay? Or you can forget about remodeling. You had really, really complicated, very, very years-lasting neuropathic pain, or like fibromyalgia, for example. Again, this is where you are. This is you're going to treat your patients with. So this is presets according to the phases. I tell you one thing is that we have this actually as we call it the sport device mode. Yes. So if you go into your screen and you get into your where listed all the programs, the icon of the book in the programs on the left side or if I look at this, it will be on my right side of the screen. You will see there is an opportunity to change the way your device show interface into sport mode. And then you could see all that, and automatically every assigned frequency is assigned to the process. So you could use this way to treat your patients, particularly if you understand the curve, this healing curve, and then you would be able to navigate and set your device this way. Okay, so how do we treat? There's basically 3 steps. First of all, we set up the device. Setting up the device, you need to know where your patients on this healing curve. Yes. So for example, if you deal with acute pain, you go for acute box. If you deal for chronic, you go into chronic box. This is recommended presets. So here with ordinary pain, ordinary skeletal muscular pain, non-complicated, not neuropathic pain, okay? You're going to use 244 severely painful situation when patient walks in and says, I'm so hurting, I'm so hurting. And if they already in progress, they're recovering, they may not have pain on that day, then you just use 60, okay? And for any hypersensitive, someone who you can touch, trigeminal neuralgia, complex regional pain syndrome, fibromyalgia, you can use 15 pulse per second, okay? And then once you set it up, the preset, the second thing you need to set up, it's in intensity. And you're going to use these 2 buttons here for intensity. This is also very important to send it right. Because remember, at the beginning, I told you that each preset corresponds to specific activation of the nerve ending, nociceptors. So you could say with acute, we go in very strong prickling sensation. So this is activate everything, but it also creates concept of the gate. So we want to override the pain if it's too strong, yes. The second, chronic, comfortable tingling sensation. This is patient have to tell you. And that is, you would be using comfortable tingling to activate A delta receptors. This is receptors of most of the chronic conditions will be already sensitized. And in hypersensitive, we want also to include a beta receptors. So they only respond to vibration, but they also respond to touch, etc. So you could see the different level would be designed for you to adjust your InterX device to patient's need. So the screen basically gonna tell you which preset you're in. Here, when you place it on the skin, you're going to increase that intensity level, and intensity level come in 100%, and you could see it here. And then you have the time in skin contact. If you're not in skin contact, this man comes out. And this is your very first related to impedance reading. We call it activity reading. It's very simple. It's just first second when you touch the skin, how much skin conductivity is there. 31 on its own doesn't make sense, only makes sense when you compare. So the treatment begins that, remember, you're going to scan a device slowly moving over the skin, covering all the area which you decided to treat. And please note, if you have, for example, shoulder pain, yes, you need to treat not just where the pain is. You take bigger area. And for more chronic condition, the more chunk of body you take. Like for chronic neck pain, I would use all from hairline and all up to lumbar. I would use all that area to scan. And when I scan, I don't make any gaps. I just really slowly cover all this area. On this diagram, we're just showing the half of the shoulder, yes? It's just for the example only. So you scan all area, and what you're looking for active sites, and they are evident by, first of all, electrode's gonna stick to the skin in certain areas. So this druggy sensation. Then patient gives you feedback and say, oh, here, I really feel here, yes? Strong sensation. And then listen, always listen your device. Where the device comes quiet, there is a problem. So, and then often after a couple of strokes, you see this redness appears under the electrode. And then we start objectively evaluate it. So what I normally do, I circle all those active sites, which I think is there. So it's sticky, the sound disappears, and I put the circle on. And within this circle, I want to test where exactly, because, you know, numbers give you precision, absolute precision number. So for that reason, within this circle, I just place the device in 3 places. Why 3? It's just because it could be 2, but it's easier to discern where the high readings. So for example, 22, 28, 20, yeah? Of course, 28 is higher. So I go back to this area, and now I allow the device to create connection with this, with the brain. And then as a result of this communication, you have the much more accurate number, because it comes as a result of interaction with the body. And this number is going to be called point stim or dose. Yes. So when you see this number on the screen, it's much more accurate number related to conductivity of the skin there. So it's the more conductive, the higher readings you're gonna get. And you want conductivity, because your goal of the treatment to find the best entry, where on the body you can stimulate best, so you can deliver energy in the body. Okay, so the high number, it's the one you're looking for. Don't focus on low numbers. They just showing that here you can't, if you treat, you won't get any difference for the situation. So for example, you have this 5 positions, and you evaluated these 5 with the first activity reading green numbers, and then yellow number comes up, and you record it. If you use eyeliner, yes, you can write right on the skin of the patient, or get a pen and I write it on the little sheets where they're sitting, yeah. So first I had 37 here, point stim. Then second, I evaluated, left the device on, second number come 32, third number come 30, then 34, and then 46. So what I'm doing now, I'm analyzing where is my gates are open, where the best entry for my influence, I look at all these numbers and I see, okay, 46, 46, most interesting. Somehow this point is linked to whatever injury is inside. So what I'm going to do, I'm going just to use dynamic treatment. But this is just to make a point. But after dynamic treatment, if I retake this number, I place again and read, typically it goes down, okay? That means the body already saturated with energy, charge is there, so the number shows us down. Very occasionally you can see the number keep growing up again, so just carry on working on this point. So this is your primary active site. That's what I think, that's your search. You of course treat all other points, but this is your focus of your attention. You know, this is a good, best point for treatment. And then you do dynamic treatment. Dynamic treatment you need to do using 3 sets. Yes, you use for hypersensitive 15 to 60, for chronic or subacute 30 to 120, and for acute 19 360. It's very logical, very straightforward. So before dynamic phase, you change the preset, you adjust the intensity so they feel it, because normally it's gonna go a bit down, and you start working. This is super important, which direction you're gonna work, because you can move any of 4 directions. I normally, for easy, relate to you to north, south, east, west, yeah? So first you just slide very slowly across, or you try in all 4 directions. Out of 4, you're gonna have 1 which is most restrictive, okay? And start then working, now you're wiping it off. Short strokes, wiping it off, because your goal is to make flowing. And after a few strokes, you hear it's become easier to flow, and you hear the sound is coming back, okay? So once you achieve this, again, very slowly check all your 4 directions and see now which direction becomes most restrictive. And it will be different, direction most restrictive. So, and you can do this until all 4 directions become more or less moving and they have sound. When you hear the sound coming back from the tissue, that means the energy is not being absorbed any longer, so you can move on, okay? Even if there is a still degree of stickiness, don't worry. The body already understood and you charged the tissues already. There is also, you could do dynamic treatment post-treatment. So for example, if pain associates with the joint, like joint movement, yes? So when you treat statically and you get this all moving, nice sound is back, you say, I'm finished, now try to move it. And they start moving and saying, oh, you know, in this particular move here, I feel pain here. And they even point it out for you. Or for the shoulder, they start moving shoulder and they say, oh, the point here or there or there. They literally point with the finger for you. What you could do, you connect with the brain this dynamically. So either put on stretch that wrist and put InterX device right there, yes, still on 90 to 360 or 15 to in variables. And then you just hold it like this for 30 seconds, or you slightly rub it like this. So same with the, on the move, they say, ah, it's here. And at this point, when they say, ah, you need to put it there and focus. And when you focus, you create the dominance again. And it's very important. 30 seconds or slightly wrapping it, 30 seconds, and then stay. And now ask the patient to come up and say, oh, I can go a lot further. Or now any movements is free. I don't have it. Okay. So this is post your treatment dynamic. So you see what's happening. So now we have this scan target dynamic protocol, Dermatome, soft tissue release, and Vagus Stim. I call it Vagus Stim. It's not directly vagus, but it's very, very close, and our electricity is very strong, so it's going to impact vagus the most. So let's look at these techniques. Scan target dynamic, what you could see here, it says anywhere in the body. You can apply this principle anywhere, and it's the most used technique in InterX therapy. So you could do it on the spine, on the joints, you could do it in the little toe, or you could do it in the face, you know, you could still do the same. On the stomach, for example, you scan the gut, you scan the gut, and then you find your active sites, you circle it with your eyeliner pencil. Now you know you're going to focus on this. Then you target each of them. You read first out of 3 readings, then you target. You get the number, yellow, remember, point stim number, and just write, for example, 55, next number is 38, next number is 82. And then you know, out of 3, already I need to focus on, for example, ascending bow, yes? So your 84 or 83, whatever is there. And then you put on dynamic mode, so you put this oscillating frequency, and you start moving and look which way it's most restrictive, yes? And do this sweep, 4-directional sweep, until you get the sound. And so, and then you go back to the points where you have less, yes? So there was the 55, 38, 83. So now I'm going to 55 point, again, 4-directional sliding technique. And lastly, I'm gonna do on 38, yeah? And then you just can do all the areas smooth with your dynamic, and that your treatment is complete. So dermatome, it's a kind of combination. This is a concept, okay? Dermatome is a concept, and you really familiar with your line of work. All of you here very familiar with this, because dermatome, it's a distribution of specific nerve to the skin. Why is it important for us? It's important for us because we use the skin as a guide. And we stimulating the nerve endings living in the skin. But remember, from neuroanatomy, you have each level of the spine branches into 4 branches, yes? Dermatome, that's where we trace. Then it goes meatome, goes to the muscle. Then it goes to sclerotome, which goes to the ligament and the bone corresponding part, and last is visceradome, corresponding organ. So by finding things on the surface of the skin, you actually address all the structures, because they share the same nerve root, so to speak, yes? So this is, dermatome is super important. So through the skin, we target all the structures, even corresponding organ. And this is a map for you, very easy to find. So if you deal with the wrist issue, look where this wrist goes to the spine, yes? So it goes to the spine at this level, thoracic 2. And so what you need to do, you need to treat the point of problem, or tennis elbow, yes? You place it there on the point of pain, but also connect it through dermatome with the spine. So you're gonna work all these areas. Knee pain, always correct to lumbar 3, lumbar 4, yes? Heel pain, look at this. Heel pain is all related to sacrum, yeah. So this is the diagram, what you're gonna do. This is your pain, find the pain, and take not just one, a few dermatome and corresponding spinal roots, okay? This is your optimal treatment. Often, I also include very short time contralateral. It's very good for joints, like knees, you know, ankle joints, etc. Okay, so now we're talking about second technique. It's called soft tissue release. Soft tissue release is, I would say, so important. Very, very important, because I'll tell you why. Because probably 80% of the issues coming because of the misalignment in the body. Okay, and misalignment in the body is not often happen because the problem with skeleton. There are some issues with skeleton which can cause it, but most of the time it's inappropriate tension within the fascia in the body. Yes, and remember, fascia is the one, it wraps around every muscle, wraps around every vessel. It wraps around around every organ like a capsule. Yes, it gives rise to all those tissues, like the muscle grow out of fascia. Yes, so the significance of fascia is huge. It's absolutely everywhere in the body, even in the brain in form of glial cells. Yes, so what is happening? Our body compensates. You had some, let's say somebody had some time ankle injuries, and that ankle injury happens like years ago. Whilst you're healing that ankle injuries, you would be compensating through your other side. Yes, instead of you favoring your left side, and you compensate on your right side. And so whilst through this compensation, you will start building up more muscles on this side. So this is already creates some imbalance. If you didn't properly treat that ankle injury, you're already going to have imbalance, because the pelvis connected to the spine at this point. So there will be already shift in the pelvis. Pelvis start tilting, pelvis start going left or right. And then again, if this is not treated, the next stage you go, what's very fixed. Thoracic is fixed with the spine, yes? So the joints between them, the neck, C7, or start getting out of alignment. And then C1, C2, because head sitting on the spine again. And what is happening? Because muscles have different builds, the fascia itself has ability to contract, yes? If you sit and you stress, they become very tight. So it's like snowball effect. Fascia becomes very tight. The lymph is not lubricating fascia well. It's becomes sticky, and it literally becomes solid. Yes, and try to repair this when the patient comes to you already in old age and they have so many fascial issues. It's really difficult. So the only tool, not the only tool, of course, there are many tools. Physiotherapists use their hands, they use a variety of tools, massaging tools, etc. But this is the only tool which does it together with giving the body charge, because you cannot repolarize muscle, you cannot repolarize, or muscle cells embedded in fascia, tight fascia. You need a charge. You cannot just physically move, do massage, and import a massive charge for repolarization of that stuck muscle. Yes, that's why this is like image of your knuckles. Yes, so as if you're massaging the body with knuckles, and then you have here the actual high voltage, high current density device. Yes, so it gives you that necessary charge. So combination of both does remarkable work, remarkable. So when I treat patients, in the end of my session, my sessions have an hour. In the end of my sessions, I do at least 5 minutes of soft tissue release. Again, anywhere in the body, and anything which you even suspect there is a fascia, tight or misaligned, please do this technique, because this is going to resolve so many things. And if you do session by session, you resolve it. So technically what you do, it's very simple. You go from hairline of the patient, so electrode is placed here. You put it on the same 90-360 or 30-120 or 15-60 according to the stage of the patient variable. And then you go down the spine first, like you drawing a Christmas tree. You work on the trunk of the Christmas tree, few strokes. And as you go, you assess the degree of sticky fascia. So at some point it will be so sticky and the device also be sticky. You feel like that stickiness. When you hit this point, you could see here, there is like little indentation. It's for you to hold it, yes? So you press and then you release. So if you go like this way, you go finally, oh, sticky here. So you press and then release. And you do it with angle as well. Yes. You will feel it. Those of you who are doing lots of manual work, you would be so natural with this. You will feel even what sort of movement, which direction you want to move that fascia, yes? And after a few strokes, what you notice, it's become jelly-like, it releases. And because you change the structure of the water, you change the structure of the actual fascia itself, and it's become relaxed. And when it's become relaxed, the charge is flowing, everything is flowing. And so you go all the way down, you go all the way down to the bottom, the very coccyx area. And then you start painting the Christmas tree. You go through each vertebra in like here, it's intercostal positions, yes? Again, you draw the Christmas tree all the way down. And look at this, when you, after lumbar, you start going almost like, again, look at the Christmas tree, it has branches growing like this. It goes down, it goes towards the leg. And here you go over the buttock, really work the buttock off, yes? Because every single person has congested sacrum, I tell you, because it's our lifestyle. So if you release here very well, and you release the neck, because again, lifestyle, we're on the computers all the time, you're going to achieve so much from this session. So as you go, you'll feel sticky points, and then look at this photograph. You could see where the fascia most sticky, and it will be represented with redness. Redness, it's blood vessels which start showing up, over the underneath the skin. That's why it's pink color. And suddenly you improve blood flow here. Yes, when you improve blood flow here, you initiate healing responses. You bring oxygen. This is starved by oxygen tissues, and they are most of the cells will be in anaerobic functioning, inefficient for energy production. So we already resolve so many things. We release fascia, we change the oxygen supply to these tissues, and we help by releasing this. We put the body a lot straighter. So each session you do this treatment, the body getting straighter, because next time this is not going to be an issue. There will be completely different parts of the body. Very good to release fascia, iliotibial fascia on the legs. Whenever you deal with anyone who has got knee pain, you must work on iliotibial fascia, because that's really very tight. You must work on the behind the leg, on the calves. If you deal with the condition, we have the plantar fasciitis, that's what I was going to say. Plantar fasciitis, bottom of the foot. Don't limit your work just for the bottom of the foot. Everything is linked in the body. Work from your waistline down. All the sacrum, release the sacrum, release hamstrings, release calves, then work on Achilles, and then work on the plantar. Do you know, because everything in the body, it's like one knitted jumper, like sack, and the tensions go all over. And normally, if I deal with post-stroke patients recovery, I release them from the head, you know, especially if they're bald, it's really easy to work, but If not releasing with soft tissue, you can use the comb and release the very tight scalp. So all this needs to be addressed. Shortened muscle syndrome, that is the one which I was talking about. Shortened muscle syndrome, you could see here. This is, let's say this is a knee joint and this is your iliotibial band. If it's too tight, what does it do for skeleton? It puts it out of alignment. Okay, this is normal alignment, the gap. And here it's out of alignment. What's going to be wear and tear here, and then inflammation in the knee. So this is really important. Same, super important to work on the neck C1, particularly atlas, cranium atlas and atlas axis. Atlas axis also relationship. Because what's happening, not only it's physically make the neck goes twisted, it's actually affect the foraminal magna position against the spinal cord. So you have the accumulation of fluid. It's not cerebrous spinal fluid is not functioning very well, and you know it's super important. So the technique for that, particularly for the second one, it's called 3-in-1 vagus stimulation. This technique is difficult to do. This is why it's called vagus stimulation, because you're going to use 3-in-1 protocol here, and that is where very close the ganglions of the vagus nerve come. It's really close to the surface here. And so when you stimulate vagus, then you get relaxation, huge relaxation. So this technique is used for muscular relaxation, retraining, and range of motions. I need a demo body. Increase range of motions and general relaxation. If you can't get pain relief locally, you can always get pain relief through using 3-in-1 protocol. Okay, I've got demo patients. So very briefly, I'm going to show you the protocol. You plug the device in, the soft tissue electrode. You need to find in your book of the presets, you find preset number 11. Okay, it says 3-in-1. 3-in-1, 3 seconds on, 1 second off. You not increase any intensity or anything. You need to place your soft tissue electrode along this muscle and drive along the trapezius muscle to the point when you cannot go slightly this way. Yeah. So it doesn't go any further. Okay. And then you need to get underneath of the trapezius muscles. Underneath, yes. So you with this movement, and then handle should be closer to the ear. Yes. So the position is like this. Okay. So right now, I'm going to increase the intensity for approximately 10 and ask my patients, do you feel any sensation?
Yes.
Yeah. Does it go into your earlobe?
No.
Okay. I need to get to that point. Yeah. So I increase a little bit more. Yeah. And now, do you feel it? You can see neck is contracting muscles, trapezius muscle contracting, elevated scapula contracting. So very good. You have 3 contractions like that. Okay. And then you turn the intensity down and you go on the other side. So you go with it again, drive until you reach the neck and you can't go any further. Yes. And then underneath the trapezius muscle, a vertical handle. And now increase the intensity to 10. Do you feel any contractions?
Not yet.
Okay, it's a bit difficult for me to do the other side. Okay. Now feel the contractions, yes?
Yes.
Okay. When he feels contractions, I increase to approximately 20, maximum 25, 30 is and I hold it until I have 3 good contractions. Yeah. Sit like this here. And you can see 3 seconds on, contracting, 1 second off. Okay. Right now, if you see the range of motion is really well, yeah, and the tension in the trapezius muscles is reduced. So thank you. Okay, so let's repeat the sequence of this protocol. It's very important. So first of all, we choose in the menu preset 11, find 3-in-1 protocol. 3-in-1 is 3 seconds on, 1 second off. This will give you the contraction and relaxation, contraction and relaxation. So almost like you exercising muscles like with the TENS device. Okay, before setting the intensity, slide the electrode over the trapezius muscles to the end, the neck basically. And then you need to get into the underneath the trapezius, splenius captis, trapezius, and scalenus posterior. So that's anatomical position. Set at the gentle, comfortable level of 10%. Some sensitive people will be already responding at 10%. So ask the patient if feel any tingling sensation and should notice the muscular contractions. And then once you find the right trigger point, don't move. Just increase to approximately 20 to get a really good, this sort of motion, like if it's a circular motion of the shoulder, yes? So when you get this, don't go over 30%, my recommendation. And you get 3 on one side, 3 on the other side. And before you start the other side, always bring the intensity down, then you can do it again. So don't use this technique when dislocated shoulder or when very frail elderly, especially very skinny, bony, because they most of the time develop spurs, and these spurs can puncture on the some I don't know, maybe pinch some muscle tissue, maybe nerve tissue. Now, spinal assessment, I'm gonna overrun a little bit, but no, we're almost there. So spinal assessment, this technique is used, a very, very, very useful technique when you don't know what to do, okay? So if you say, dealing with patient who's got many complaints, gastrointestinal headaches, palpitations, whatever, tons of complaints, and you don't know where to start, and they're in pain, you're working with pain, of course, you could do this protocol. It's really, it's completely non-damaging. You're not gonna aggravate or do anything. It's really balancing, really nice protocol. And it allows you to selectively treat the spine. And the spine, of course, all information about your body relates into the spinal nerves control it. So it's very good technique to do it. So what we're gonna do, we're gonna work in threes. We assess 3 positions. We choose out of then 3 active sites which are most important. We treat them once again, and then we get out of these 3 active sites one number which is highest of all, and this number will indicate where the body is open for your manipulation. So In this case, you can see within the cervical area. So I will be focusing on treating that. If, like I recently treated the patient and his highest readings were here in the lumbar area, I know he is ready to be treated on the lumbar, although he has also cervical problems, yes? So it just point out, helps you to find where to treat the most. So let's look at the protocol. So we use typically 60 because it's for chronic pain, or 15 if we're dealing with people who are hypersensitive. We set the intensity comfortable tingling or even vibration for neuropathic patients. And then we get this piece of paper and we want to use 3 positions. So we write it here. So for that reason, use your actual electrode from the device as a square, yes, and map this underneath the electrode first, then second, underneath, next, and you go all the way down and work in 3s, yes, left, center, right, for example, yes. It doesn't matter the order, but the idea is that you map 3 positions of the electrode. So for example, first 3, you take the first readings and they are 24, 25, 36. Once you've taken them, you analyze. 36 is the highest out of 3. So you go back to that area. Now place and point stim, just wait for the device to give you a number. And in the end, you see this yellow number 49, which you record here, but it's already been treated. Then next 3, yes? So now we go 26, 29, 20. 29 is highest. I go back to this point, leave the device on, wait for the 54 to come and write it down. So, and you go like this each segment. So in the end, you have these numbers for each segment. Out of 3, you have highest. If you have same 2 highest numbers, do stimulate them both, okay? And write down the point stim numbers. So you can see at each level, you have always 1 get treatments. Once you complete it, now you have to analyze and see which out of 3 the highest. So you have this 40, 43, 45, boom, 57, 67, 56, 50, 56, 54. So you could see 1, 2, 3. And already I can see the pattern. This person has sciatica pain, yeah, because this is mid-thoracic and this is coming to the hip area. So 56, 67, 56, 3 highest readings out of all. So we choose these 3 highest readings. And we treat them again, and we treat with point stim. So we leave the device on again in all 3 places. So this part of the scheme gets 3 times long stimulation, yeah? So it's already creating dominant in the cortex of the brain. And in the end, what's the highest number? 67, 58, 54. That's becoming your starting point for your treatment. So you know, with this patient, active region is thoracic region. So until you clear this, these patients will not recover from sciatica. So it's really a simple protocol, but nice to work with numbers because it's kind of like delicate. But normally when I treat patients like this, I work with numbers and then I use soft tissue protocol to do soft tissue release and the treatment is completed. And very often I finish it with using the 3-in-1 protocol. So you can combine the protocols. So general zones, what are they? General zones, it's when we stimulate and the effect goes to the whole of the body. So systemic effect. So spine, it's always going to do systemic effect. Stomach, yes. Head will give you systemic effect. What else? Reflex zones, feet and hands. Face also systemic effect. So now we learn that we can in a simplistic situation, we learn the basic protocol where the pain is. Acute, just happen, yeah, primary. This is local. With more chronic condition is going to be dermatome. So not only where the pain is, but also dermatome, corresponding spinal root opposite. If people have multiple pains, you can use assessment protocol in threes, but you can also use 3 pathways, or you can use soft tissue release. Yeah. When you deal with chronic problem, always introduce treatment of the abdomen. This is really important because all our chronic patients will have some gut disturbance, and we must address it. If we don't, they will never recover. And on the next training, we're going to talk about this particular neuropathic pain specific point and specific acupuncture points. I'll teach you how to treat acupuncture points, which you know. So if we have like literally a couple of minutes on case studies, I just want to demonstrate you how to use for acute injuries. If you use the InterX, you can immediately make the difference into recovery. This rugby player had very serious surgery, very serious injury, and yet he used 1 or 2 InterX treatment daily, especially at the beginning, whilst it was acute. And he came out to play two months earlier than expected. And you know, top players, they get top physio treatments. Regular results like this, a patient who had back pain, a low back pain, came to me after 2 years. He tried everything, no resolution. Treated him 3 times, in 3 sessions weekly. We resolved his pain. Mostly I did soft tissue release. You could see it here, yeah. And 4th session was just because he came. I just did 1 more session, but really resolved it. In a similar way, it's another patient with muscular scoliosis. You could see it here. Disc hernias, very, very good. But some disc hernias could take a long time. Non-complicated fresh disc hernias, 3 weeks, you can get decent pain relief. In his case, that was within 3 weeks, he was from 10 down to 0 pain. But it actually all happens in stages, from 10 down to 5, and then from 5 down to 2, and then from 2 to 0. But sometimes it's complicated, could take 4 months. Foot bruising. This is another, remember I showed you that blue time in the onset of injury. That happened in my eyes, in front of my eyes. The floor tiles fell on his foot, and immediately bruise come out and agonizing pain. So immediately I 480, and I placed InterX on each, like place around the bruise where the pain was. So this is 3 hours, and we did this 20 minutes. I'll just place, and then 20 minutes in between, then another 20 minutes, then again a gap, and then another 20 minutes. So in 3 hours, look at this, bruise gone, the skin start closing up, no pain. And this no pain situation, pain never came back. It never. Week after he completely recovered, but next day he even jogged because he thought no pain, you know. But of course, immediately understood that he needs to not to jog on this food. Just phenomenal result. You can get this too. This is a boy, 12 years old. A bus drove over his foot, and you could see InterX is already underneath his foot. 1 hour, mother was treated him with InterX device in the paramedic in the car, because it took an hour to get to the hospital. And look at this, the bruise is so much better already. Compare this and this, yeah? And no fracture. This is the back of the foot. And he recovered 2 weeks, he was already at home. Shoulder fracture, you could see this chipped off the humerus. The snowboarding accident, and he came to me a week after this pain because he was still in skiing, and now I treated him once a week for 2 weeks, and at home he used his personal device 4 times a day, personal device application. So 3 weeks, complete healing. You could see it on X-ray. Tendon injuries, tendonitis. Again, 3 weeks, there was a ganglion here. But severe chronic, it took over months to get pain under control. But he had 2.5 years severe tendinopathy. So when we don't treat when people have cardiac pacemaker or pregnancy, okay? All the rest is the cautions. So we don't place over the malignant tumors, but you can place in other parts of the body. We don't place over the mucous membrane, mouth, anus, just for the not passing the infection. Patients who are prone to seizures, I recommend you not to touch them. Yeah, and many of your patients probably will be on anti-epileptic drugs. Yes. Over throat muscles, you can, but don't sit on thyroid gland because that can swell up and restrict breathing. Thrombosis, varicose, you have to just pay caution. So you can place it, but don't drag it, don't squeeze it, because if you do this technique when you want to squeeze it out, then it's going to be a disaster because you can dislodge the thrombi, okay? So only in the light skin contact and only like stamp. Then you don't dislodge thrombi and you can reduce inflammation. So this is a subject for next time, much more complex. And I must tell you that, you know, there is a lot more to say to this. There is a lot more to say in terms of how much knowledge is there. It's incredible. So I am very sure that Bev will help you to do practical and get these all techniques under control. And there are lots of nuances to this, but I'm sure you in the end get a good result. So for now, I want to stop talking. Please, questions, any questions?